What's up, you guys? It's Dr. Italo Brown here. If you've been paying attention to any of the major media outlets, you're starting to hear more about racial ethnic disparities in COVID-19. Now, I've been talking about this for the last few weeks on the up and up, so I decided that I wanted to take just a brief moment to break down what that means for you. All right, so they've been throwing around a big word, epidemiology. This is the study of diseases in different communities. Now, when we initially looked at Italy and China, we based our national response around what happened in those places. However, if you look at the fabric of most US cities and what areas are densely populated by people of color, you also see a common trend. These communities have major illnesses. In fact, you can almost say that communities of color bear the major burden of illness in the US. So what do you think is going to happen when you have a pandemic? One that's known for literally seeking out people who are among the sickest of the sick. It's going to affect these communities. And these communities have people who look like me, who look like my family members in them. In fact, they look like your family members. They look like people you know, people you grew up with, people who went to church with you. We're talking about the communities of the Bronx, Brooklyn. We're talking about Chicago, Detroit, Louisiana, specifically New Orleans, Milwaukee. These are places that are racially, they have communities of racial and ethnic groups that are cohorted. What that means is they are living in situations where they can't easily socially distance. In some situations, you've got multiple family members living under one roof, meaning multiple families, not just one isolated family. You have communities where one big building has multiple groups of small families, undocumented citizens, immigrants. These are the communities that are being ravaged, by this illness. And so I really implore you to pay attention to this data. The hard part is they have to release the data to us. When you look at Michigan and Illinois, they're showcasing this information on their departments of health. But if you take a look at other major states, they're not sharing this ethnic data. In fact, the CDC doesn't even have it. I think that there is a problem when you know data exists, you can foresee a trend, but you fail in trying to predict new epicenters. And the way that we can predict it and potentially stop people of color from dying is by blending population mapping, meaning looking at what these communities tend to look like, taking the epidemiology of disease and seeing where do these ethnic overlaps exist and starting to target those, because that is where you're going to find the major burden of illness and the major effect of COVID-19. Okay? If you are Black, if you are a person of color, you need to stay indoors. It is not a game. We already know that you have pre-existing illnesses like asthma, COPD, diabetes, high blood pressure, obesity. These are all major risk factors. So it is imperative that you talk to your loved ones. Be extremely blunt with them and tell them, I need you to stay indoors. Let them know that it is open season out here for people of color, and COVID-19 does not care, okay? So that is my major public health message to you. I'm just a ER doctor who understands public health and is trying my damnedest to help every single person follow some basic preventative measures while applying pressure on the agencies that are supposed to take care of us and provide data effectively so that we can have an appropriate response to the greatest pandemic that our generation has ever seen. All right? Get familiar. I'm done.